Hi, this is Matt Gallegos,
And this is Becca Horgan.
and today we'll be talking about
Echinacea.
echinacea.
What is it? Echinacea is a type of herb that people commonly take to help combat the flu and colds. It is a genus of herbaceous flowering plants in the daisy family. It is also sometimes known as the American coneflower, and it can grow to approximately 1 to 2 feet tall when it is completely mature. The roots and the seeds are used to fight bacteria. It is commonly used with colds because it increases the immune system while it is preoccupied with fighting the cold virus, thus decreasing the time of the cold symptoms.
So, who would use echinacea? It was once used in traditional herbal remedies by the Great Plain Indian tribes and can now be found on its own or added to over-the-counter drugs such as with cough drops. The Native Americans used to use echinacea because they first had seen elk seek out the herb and eat it whenever they were wounded or sick. They then named it the elk root. It is used with the common cold, and there's plenty of research out there that gives different suggestions on how much echinacea should be used at a time or every other day or whatever the research would suggest. There's different suggestions out there. Individuals who have become resistant to certain antibiotics and or who suffer from an inflammatory condition. There is insufficient evidence that proves to be a limiting factor in its effectiveness. Studies vary on echinacea plants used and the dosage prescribed. Other conditions mentioned include gingivitis, herpes simplex virus, anal warts from HPV, influenza, middle ear infection, and tonsillitis.
What are the effects of it? The health benefits of echinacea are owed to its diverse makeup of nutrients, including polysaccharides, flavonoids, vitamin C, and zinc. Echinacea has been found to have several benefits, including boosting the immune system, reducing redness and swelling, facilitating oxygen transport for healing, supports oral health, such as reducing bad breath, alleviates aches and pains, promotes upper respiratory health, and provides antioxidants to the body.
The side effects and adverse drug reactions of echinacea include fever, nausea, vomiting, stomach pain, diarrhea, headache, and skin irritation and rash if topically applied. It has been proven to be safe for most people, however, when taken orally. The side effects also for this drug are controversial as many people have had different side effects, and it really depends on who takes it. And it will most likely cause an allergic reaction to people who already have ragweed, marigold, or daisy allergies, or even the seasonal allergy. Do not take echinacea if you have an autoimmune disorder such as MS, lupus, or RA, since it boosts the immune system.
Echinacea is also similar to a couple other type of herbal remedies, such as golden seal, which is also used to treat skin infections and in particular the cold and flu symptoms. Garlic, which is also used to treat the common cold and cough. Green tea, which can be taken for its antioxidant. And then Siberian ginseng, which is used to treat influenza and infections. So as you can see, most of these other herbal remedies are similar to echinacea in the way that they help treat cold and flu symptoms in particular.
The first study that we looked at by Rodatelli et al. Looked at are considered 82 articles relating to the preventative role of several nutrients with the common cold, including echinacea. So they say that although further research is recommended, of the articles considered, it was found that a prophylactic treatment with or using echinacea extract, 2,400 milligrams a day, over a 4-month period can adequately prevent and treat the common cold. This article also found that echinacea being used as a synergistic drug with other medications such as the flower Judicia adetoda or other kind of herbal plant species can help with treating respiratory tract infections. And specifically, they looked at it being used synergistically to treat or to work as a powerful antitussive agent in the acute respiratory tract infections.
The second study we found was called Echinacea for Treating the Common Cold, and it was a randomized controlled trial of 719 patients aged 12 to 80 years with a new onset of common cold symptoms. So the patients were assigned to one of 4 groups. Those 4 groups included one group taking nothing, The second group took placebo pills. The third group took echinacea pills and they were blinded. And then the fourth group took echinacea pills and they were unblinded. So the patients rated their severity of symptoms twice daily by using a self-report called the Wisconsin Upper Respiratory Symptom Survey. And then secondary outcomes included interleukin-8 levels and neutrophil count from nasal wash assessed at intake and then 2 days later. The illness duration and severity were not statistically significant with echinacea compared to the placebo. So basically these results do not support the ability of at least this amount of dose of echinacea to substantially change the course of the common cold for a patient.
So the burning question you've probably been asking yourself this whole PowerPoint is, would we recommend it? Well, to say briefly, maybe. It has been found to help fight against certain bacteria and or viral infections by boosting the immune system, but the marketing for Echinacea products is often mislabeled. You need to be cautious about buying these products because many of them use the term standardized, which does not mean anything in terms of the regulation of this drug. Oftentimes the actual flower or the actual drug used in these is more or less a placebo, and these companies are trying to sell you something that isn't truly Echinacea. The price range from these bottles or products range from $4 to $20 a bottle of approximately 400 milligrams, and since herbal remedies are not regulated by the USDA or USA, once again, these are not regulated and cannot be identified during or via the FDA. So finally, once again, we can tell you that if it helps the patient or if you feel like it's helped you in the past, sure, go ahead and try it, but it wouldn't be something that we would prescribe normally. And here are references. Thank you for watching. And if you have any further questions, you can find us in your nearest prairie field picking the wild echinaceas.